We have completed our 4th year and we're headed into our 5th year of this project. We have seen so much growth and progress, and not just our grantee sites, but across the national landscape.
It was a big, bold idea. This program started because someone had the bright idea with the forming this alliance of community partners,
Right.
community health systems, academic health systems, and organizations like the NCCN. The concept was, could we bring the best and brightest ideas around innovation to remove barriers for more people to get into healthcare through navigation? And so it seemed like such a simple idea at the time. Initially, we were like, well, why aren't we doing what all academic medical centers? And the wisdom that says, because the program isn't for academics, the program is to learn what is the best way to do navigation across the continuum. We all came together and said, you know what? Interesting enough, one size doesn't fit all.
Just watching the progression from each of the sites and how we have all learned from each other. I think that is one of the, biggest take homes from being a part of an alliance, is that you had a community site like Mary Bird be able to take lessons from an RWJ, right? And be able to implement that into their workflows and their implementation strategies, and be able to grow from the work that's happening out in Dillon, Montana, and be able to build that into some of the work that's happening in New York. I feel like that is, at the end of the day, the strength of being in the alliance as a whole.
There was something that came out of Kentucky, University of Kentucky, that they put in the field that now many of us may be able to scale that up and then use it for our patients.
Across the board, we had some sites that had leadership buy-in from day one. And then we had some sites that were growing in their leadership buy-in, being able to make that business model case for why providing equitable cancer care was important. And although we talk about it from a navigation standpoint, it's important to understand that all the sites don't have navigation, but navigation is kind of consistent throughout the project. Tailoring and targeting some of these implementation strategies and what to do if you don't have Epic, or if you have Epic but you don't have the Epic. So being able to take the lessons learned as far as implementation and as far as workflows are concerned. They were just running a program. They didn't know whether it was effective. They didn't know whether or not. So we referred someone out for a social driver of health referral, but did they get it?
Yes.
Did they receive it? Did the transportation ever show up? And so making sure that they were tracking and having benchmarks for what success looks like. That's definitely something that we brought to the table from an alliance standpoint that wasn't there. We've established those benchmarks and we're tracking these outcomes that weren't previously being tracked before.
We bought in this concept that evidence-based is not a 4-letter word. Once there was an embracing of that, I think that's when the program really kind of took off. There are people who do navigation as an activity, and then there's navigation that is impactful. Those two may sound similar, but they're worlds apart. This program was really about not just thinking about an activity as much as it was thinking about removing obstacles and impact.
What we were trying to be able to say is, what does success look like for the alliance? We still wanted that success of what cancer care looks like to be the same. For breast cancer diagnosis, from treatment to diagnosis, is 30 days. And we wanted at least 90% of our patients to be able to make that transition in 30 days. And so now what we're doing is making sure that that care is equitable, whether you're in Dillon or whether you're in New York. Looking at it from that perspective really drives in some of our work, and what we're going to kind of leave for the field to drive forward is making sure that everyone has opportunities or expectations, or we define what that looks like. It's about really taking it back to your community and what works for your community.
If one were to come back and say, what are some of the lessons learned from the Alliance? We have now proven, not a theoretical point, but we've now put it in the field. And we said, you can do these things. We decided that this program is the shining light of what can happen in not just some areas, quote, that are overly resourced, but in all areas. The goal was not navigation. The goal was to remove the obstacles.
Exactly.
The thing that moved me the most, we had a couple from Montana, and the woman said, well, in Montana, some of us go in the hills, but we know we can't get the care, so we just accept and we just die from cancer. And her husband was sitting there. He said, if it wasn't for this program, my best friend in life wouldn't be here. And they looked at each other. And she looked and she said, I was patient zero. And she said, thank God for not only this program, but for me, it meant that by doing something and thinking differently, we were able to allow that community to solve a problem. They were like, we never thought something like this could happen. And in fact, it happened not just because it was a happenstance, but literally because of this program.